Good afternoon and welcome to Consulting Room 5 with me, your host, Dr. Sue. In recent weeks, flooding has become a recurring challenge in many of our communities, especially during the rainy season. Beyond the damage to homes, roads and businesses, floods pose serious health risks that can affect individuals and entire family. As we anticipate rainfall in coming months or certainly years, which is inevitable, it is important that we not only respond to floods when they occur, but also prepare adequately to reduce their impact. Today, we will discuss the health effects of flooding, practical measures families and communities can take to prepare for future floods, and the role of every citizen in building safer and healthier community. Stay with us as our distinguished guests share experts' insights and practical advice on this particular topic. Don't go anywhere. Welcome back to Consulting Room 5 with me, your host, Dr. Sue. Today we are discussing flood once again and its effects on human in relation to their health. And we have two special guests who are well versed in this area, two health experts who are going to discuss the effects of flood on human. The first one is Dr. Benson, who is highly experienced public health professional and a nurse with over a decade of clinical practice. He holds both a master's degree and a PhD in health, specialization in environmental epidemiology. He is the Chief Executive Officer of Quick Medical Consult, a non-governmental organization dedicated to improving health outcomes through advocacy, community outreach, and accessible healthcare services. Under his leadership, the organization uses various platforms to promote health education, like what he's going to do, organizes medical outreach and healthcare services for corporate institutions. So as a corporate institution, you can call on him, and also serve privileged communities across Ghana. And he also does mobilizations of resources to support children from financially disadvantaged families who require life-saving surgeries. The second person, or I should welcome you. Yes. You're welcome. Give me five.
Thank you.
You are doing well with your NGO.
Thank you very much.
Yeah. So anyway, so the second person is Miss Irabna Kweba-Darcy, who is also currently the Health and Nutrition Technical Manager of World Vision Ghana. He's also a public health professional with more than 14 years experience in community-based health interventions. He also does social behavioral change communication programs. He's a public health research intervention specialist who does more of public health strategies, advocacy, and interventions in communicable and non-communicable diseases. She also is a CEO, and the organization is ERA Health Consults International, which does health systems management, capacity building management for health workers, public health research, data collection, and all others that are related to research. He also does a lot of community services. Over the years, she worked with the Kintampo Health Research Center, University of Ghana School of Public Health and Department of Psychology, Ministry of Health, Ghana Health Service, Ghana AIDS Commission, and other community-based organizations in implementing public health interventions. She has a master's in public health, and she's currently pursuing her PhD in public health as well. So she's well versed in tropical medicine and other related health issues. So, Miss Irabna, you are welcome too.
Thank you.
Black Beauty.
Thank you.
So today, I'm privileged to have two health experts. They are also CEOs. Era Consult International and
Quick Medical Consult.
Quick Medical Services. Okay, so I'm privileged. CEOs, associating with CEOs, that's great. Anyway, the current flooding issues that have been affecting especially our urban centers, as health experts, how do you think, let me start with the gentleman. Ladies first though, by you, I'm just abusing that. So, how does it affect humans in terms of our health? During flooding, what are some of the health impacts that we should look out for or that usually happen?
Right. Thank you very much. Let me first of all extend greetings to our cherished viewers.
Right.
Flood continues to be a major problem, not just in Ghana, but globally as well.
Okay.
And of all the natural disasters that happen, about 40 to 50% is related to flood. So it's a major issue that affects everyone when it happens. And your question on as to how it affects the health of humans.
Yes, humans.
You see, once there are floods, life stops. Because once there are floods, you realize that our movement to work happens. So productivity is low.
Low, yeah.
So that can go ahead to even affect us financially as well. Financially.
Yeah.
And once you are financially down, you will be emotionally down. Then again, it can also bring rise to certain diseases as well.
Okay.
You see, when it comes to diarrhea, typhoid, these are all diseases that becomes more cholera as well. And the reason being that once there are floods, sewage overfloods. Okay, and you can have toilets coming to our home. I would want to say it as it is, so that we
are in Konsulting Room. We are permitted.
You have toilets coming into our houses.
Right.
You have people putting rubbish in running water.
So like there is a mixture of all kinds of deaths.
Yes, coming out. Yeah. So this can bring organisms to our houses. There's a video that I saw that someone's fridge, which contains all the soup, etc., was flooded.
Hey.
The question is afterwards, what are you going to use those fruits and soup for? Are you going to discard it, or you are going to heat it and eat? When that happens, that can bring this cholera, diarrhea, typhoid, hepatitis A and E that I am stressing on. During floods too, snake bites also increases. And if you had seen some of the videos that went viral during this recent floods in Ghana, you realize that there were snakes on the water. So what happens is that it forces them to move out of their holes out, and they are very aggressive at this point. Majority of them are venomous as well. So that can also lead people to being bitten.
Wow.
So sometimes we might
That's
think
dangerous.
that, yes, you might think that it's the water that swept the person away. Could have been snake bites. Yeah. And sometimes too, you see, when flooding happens, and people lose their properties, it can affect their cardiovascular health as well as their mental health as well.
Hey.
And that can lead to hypertension or exacerbate it. So if I have hypertension and I just wake up and everything is gone.
I've lost everything.
Everything.
So this is like the psychosocial aspect.
Yeah. What's going to happen is that it can cause my blood pressure to be high. I can get stroke out of that. You are gone.
So is this during the flood or post-flood?
Either ways, it can be, the shock can be within during that period. And some also, goes afterwards. So these are some of the basic ones that I would talk about. But then we also not forget electrocution.
Yes, that's true.
Electrocution can also be one. Yeah.
Miss Darcy, Doctor has mentioned a few. Would you like to add on, or would you like to say something?
Yes. So a very good evening to your cherished viewers.
Right.
And we are grateful to them for continue listening to and watching Joy News. And thank you so much. And usually, in addition to what he mentioned, there are a lot of skin infections. And I would also move into some neglected tropical diseases.
Okay.
Talking specifically about schistosomiasis and also talking specifically about soil transmitted helminthiasis. And these categories of diseases are usually not so much considered as public health threats. But the truth is that they are the real public health issues. Most of the time, our minds are on the malaria and the other stuff.
Outbreaks and all those.
Yes, that he's already mentioned.
From what you are even saying, it's more serious and dangerous.
Yes.
But are there any other diseases that occur during, after the flood, apart from these ones that you have mentioned?
Yes, so after the flood, we can have cholera outbreak.
Okay.
Because most of the water bodies are contaminated. And most of the food that have been stored, for example, if people had a ban of maize or maybe yam in the marketplaces and all those places, imagine a trader will not dispose of.
No.
She needs to, at least, if not even making profit, break even.
The vegetables.
Yes, all these vegetables will still come out on the market to be sold to us, and this can lead to cholera outbreak. Aside cholera outbreak, there are other infections that can. We've already talked about typhoid fever. We've already talked about the influenza. So after, there is also a lot of respiratory infections. If you notice the flu that is going around in Accra these days, very terrible flu that your limbs get weak, your whole body gets weak. People who have experienced the flu and are viewing would
testify.
They will testify that that particular flu, it takes like close to 2 weeks to clear. And even sometimes there's reinfection because as yours have cleared, somebody in your neighborhood own is starting, and so there is.
And if your immune system is low, you go back for it.
Yes, of course.
You know, some people, when they walk in the water, in the flood, the sole of their feet opens up like cracks, those big cracks. What's the result of that? What's the cause?
Okay, I think it's usually due to invasion of bacteria. Okay, so once you have this organism being able to penetrate through the sole of your feet, then it can get infected because there are people that don't adhere to, people don't bath, let me put it that way, or maintain personal hygiene. There are people that live on the street. You see, they don't have access to clean water than compared to other people. So once there are even tiny wounds under the soles of their feet and it gets infected, over time it's going to get open. And if it's not managed well, some tend to lose their leg because...
And that also is as a result of yours. I don't know yours very well.
I thought it has been eradicated.
No, we have a lot of yours in the country.
Oh.
Yes, recently our project in Setra East and Setra Farm Plains, we're able to identify over 100 people with yours.
Wow.
Yes. And it's especially in the farming communities. Because most of them go to the farmlands with barefooted. They are playing in the children in those communities play around barefooted in the soil, and it's easy to get. So people, and the same as scabies. So it is very infectious. Yes.
Right.
So when you have that infection also, you get that cracks in your sole. And sometimes you need to have some preventive chemotherapy to be able to help you not to get infected.
So with all these you have mentioned, which group are we looking at as a vulnerable group that we should target interventions, education, advocacy, and everything on?
Right.
You first,
So most of the time we see people talking about women, children. I want to start with men. Men are one of the most vulnerable groups that we always
Neglect. Okay.
Just as she's been talking about neglected tropical medicine.
So neglected
men.
gender.
Neglected gender.
Because you
neglected
see,
medicine.
we expect men to be very strong at this time.
Okay.
We hide our emotions to make other people happy, or to make other people.
Hey, are you sure?
Please.
Are you not being biased?
No, I'm just talking about reality.
Okay.
That we think that men are not vulnerable, but men are very vulnerable.
Okay.
Because we tend to conceal our emotions just to make everybody feel calm.
Fine.
So I'll start with men.
Okay.
Women. Children, of course, and those with comorbidities. And when we are talking about comorbidities, we are talking about people with hypertension, diabetes, and other non-communicable diseases as well. These are very vulnerable group. And I will not forget the pregnant women. Pregnant women, you see, during this time, their immunity is very low. They are very anxious as well. And there's been instances where we have pregnant women, you know, miscarrying their pregnancies in the early stage due to unexpected negative life events like this. So these are some of the vulnerable groups I'll talk about. Yeah.
But you have mentioned men.
Men.
Women.
Women.
Children. Pregnant women. Then that's the whole comprise of the society.
And the poor.
Okay.
You see, so when you are looking at social status classification, we'll talk about those that are very poor. Because the poor are the ones that live in the slum.
Okay.
And it's usually the slum that gets flooded compared to those living in high places, I call it.
But you know, we are also ignoring, you said the poor, people who sell along the street. Anybody can buy food, whether the poor, the rich, you know. And why do they keep that food?
Well, I wouldn't want to, I mean, I've invested in it. Right, I've really invested in, let's say, going to buy this fruit or vegetables or farm.
Gum, even gum and those things.
Yes.
Water.
So where should I send?
If it's in a slum area and let's say there is a flood, and then the flood also washes it off, you can't say you are going to dispose it, as Irabna was saying. So if they come back on the street to sell to you.
Yeah.
So you see how.
And I made a very good observation after the recent floods.
Okay.
That people were standing at circle selling flooded rice. So these are rice that were flooded. Some they got it in the drains. And then they, I don't know, they put water on it, dry it, and bring it to the roadside. And they were selling the 5 kilo at 50 cedis. You see. So you go and buy this, and as our sister mentioned, these can be infested with other organisms, the worm, the eggs of these worms, etc. Once you take it in, the process starts. And over time, you get infected and you are gone. Yeah.
Hey.
Okay. Yes, so when we talked about the diseases, in fact, I forgot malnutrition. But that is also on top of the issues when there is flooding, because people's reserved foods and everything are gone and stuff. So to add, but I don't want us to start a gender debate right now. Because that can take maybe more than 2 hours of your hours.
Forever.
And we might have to pay Joy News more time to have that discussion. I think even if we have a phone in, the debate will continue and continue.
Yeah, sure.
But if we talk about vulnerable populations, I really think we just have to be specific. Pregnant women, women and children. And I say children are more vulnerable in this situation. And children are more vulnerable because they are the ones that need help to move to a place, a safe place. And when it happens like this, adults are finding a safe place. And some adults find a safe place neglecting children. And some children already don't have their caregivers around at that time. And so, from my perspective, children are the most vulnerable. Women, pregnant women. In fact, in the flood, I got stuck at East Legon. And East Legon, all of us know, is a non-flooding zone. But it flooded on that day. And the thoughts that came into my mind was that, assuming I was pregnant and I was in labor and I was rushing to a health facility, what would I have done at that point? Things started trickling into my mind. And just recently, we had an assessment of health facilities in disaster prone. Some of the health workers themselves that are supposed to be there to help, they also have their homes flooded. The health facility itself is flooded. Yeah, so I think from my perspective, those are the vulnerable populations. But I agree with Doc. I don't want to start a gender.
We are very vulnerable.
Gender arguments.
When it comes to flood, we are talking about in relation to flood.
We are very vulnerable.
Yes, with other psychosocial, other mental health issues. But today we are talking about flood. So I think I agree.
Since I'm sandwiched in between you,
you agree.
So, by the diseases that you have mentioned, cholera, all the diseases, at what point do they occur?
Okay, let me start with, it's usually the post. So we have what we call post-traumatic stress disorder, and that is people's experience after a negative life event.
Okay.
There are people that after, example, this floods had happened, they can't sleep. They keep waking up to seeing like a flood in their mind. You understand? You see these children becoming very withdrawn. You see, sometimes when you see children becoming very aggressive, don't think that this child is just aggressive. Sometimes it's because of this exposure to negative life events like flood that can lead to that. When it comes to malaria, it takes, after the water has, gradually gone, some become very stagnant at places. And that can serve as breeding places for mosquitoes as well. And that can also lead to malaria. So it's mostly post, whilst the water is still receding.
So it means that after these floods, we don't even know whether there will be floods again this year, though, because the rainy season has not ended yet. But people have to take care of themselves very well, right? So anyway, we'll get to how prepared we are. So Era, would you like to add on?
Yes, so he's mentioned a lot of diseases, but during the flood itself, some of issues that can happen, or some of the ailments that can happen, is help me with that.
Electrocution.
Electrocution, yes. So some people are trying to find a safe place, and some people are also evacuating others. And in that process, that's what we can see. And there's also a lot of accidents. So you can have people who have fracture with their limbs. People also have a lot of sores around them, and there can also be fire outbreak.
Right.
So then you have burns, and you have the issues that some people also just go blackout. So you can have people losing their consciousness, and all those ones are during the flood. So during the flood, these are key diseases, key illnesses that you can find around. And it's somehow unfortunate that Ghana, we don't have so much strength in evacuation. Maybe from my perspective, we are a stable country from disasters. We are not so much into disasters. We are not so much disaster
management.
Yes, disaster management. And we are not so much disaster prone because we hardly see them. For example, this flood, people were saying that, oh, forget it, after September, when the weather changes, everybody will forget. So it's seasonal. And because of that, as a country...
But we don't want to forget. That's why we are doing it today.
Yes, of course. So I'm very happy with you and your crew and your team and your leadership for us talking about this, because it's something we need to prepare, and it's something we need to talk about. So on the side of the issue itself, the flood itself, there are already casualties falling down and all those things. Then later, aftermath, these are the diseases, the infectious diseases that we see coming. Aside the infectious diseases, we have also talked about the non-communicable diseases that come with it. So, yeah, we have a broad scale of, yeah.
I want to find out with your health facility stuff you talked about. I think you mentioned a few and it just came like a flash. Can you elaborate more on like your findings and what you got to know about those?
Thank you so much once again for this opportunity. We did an assessment of health facilities in disaster-prone areas. So K2 South was one. And so I was not surprised when their MP was in that situation at that time and he was trying to describe not only was the community affected, but their health facility too is a flood prone. Apart from that, other health facilities in these areas are also susceptible to this. So during the flooding, some health facilities were closed. Some health workers were also affected. And imagine people that were already in the facility at that time. So the assessment that we did, it opened our eyes to the fact that the health facilities that are supposed to help people during the time of these fractures, during the time of them getting these burns as a result of maybe some fire outbreak, or some of them having these bruises and stuff, they will not be able to get attention from the health facilities that are...
Because the place is affected, so how do you go?
The place is affected. So also an aftermath. Aftermath, it means that these health facilities need to be supported with logistics and other things to come back to shape. The health workers need to be supported adequately because for some of them, their homes have also been flooded. So that they are
Did you have some in Greater Accra as well?
Yes. So in Greater Accra, some of the areas that we were able to visit, some of the facilities, there was no health worker at post.
Wow.
And some of them do not have basic equipment to do certain assessments at that time. For some other areas that were also outside Accra, the facility itself was closed as well. The health workers had already left the communities. This was even before the flooding.
Because they saw that it's a flooding-prone area?
Yes, because it's a disaster-prone area, and over the years, it have either been flooded or it has gone through some of these conflicts or anything that has to do with disaster. These facilities were not functional at the time that we did the work.
So if I may ask, since we are in Consulting Room 5 and we are talking about health, what measures did you put in place for these health centers to be functioning?
Very good. So thank you very much. So this is an eye-opener, and we've had a technical working group. We've also had some validation meeting with leaderships of Ghana Health Service, and we are all putting our house into order. So one key thing is to have an emergency preparedness response plan. And so these facilities themselves need an emergency preparedness response plan at post. Then also, we also need to let all the health workers, usually we see these documents as administrative documents. So they will lie on the decks of the district health director, or they will lie on the decks of the regional health director. But the facility itself that sits in the community and is affected would not have a response plan. So the facilities would have to draw a response plan. In their response plan, they would have to look at the equipment or the medical and non-medical logistics that they will need. Some of them might need the jackets, the life-saving jacket, so that at the time of emergency, they themselves can protect themselves, their lives, and their own families. But in the facilities that we went to, there was none. There was none.
Unfortunately, there was none.
Yes.
So you are watching Consulting Room 5 with me, your host, Dr. Sue. We are with Ms. Irabna Dazi and Dr. Benson. We are discussing the health effects of flood on human. Don't go anywhere. We are going on a quick break. When we come back, we are going to discuss the management. How are you going to manage it? How prepared are you to face another, in case there is another flood next year or even before the year ends? How prepared would you be? So don't go anywhere. We'll be right back with a lot of interesting and educative discussions. We'll be right back. Welcome back to Consulting Room 5 with me, your host, Dr. Su. We are with Miss Irabna Kwei-Badazi and Dr. Benson, who are health experts. We are discussing effects of flood on humans' health. And they have mentioned a few things, the diseases that may occur during and after flood. And we have discussed so many things. If you have missed, you have missed. So, but you haven't missed. We can continue. We will see how prepared are you in terms of flood. After the flood, what would you do as an individual, as a family, as an organization, as a country? What are we doing to prepare ourselves towards such flood instance, and also the health measures that we have to, the precautions that we have to take to prevent ourselves from having or getting all these diseases that they have mentioned, all the wild diseases that they have mentioned. How can we prevent it? How can we take precautions to prevent such diseases from its occurrence? So I will this time start with my ladies first.
Yes.
How prepared should we be as a country first?
So thank you once again, and welcome viewers to the continuation here.
Viewers, you're welcome.
Yes, so as a country, we really need to be prepared. I extend my warm greetings to NADMO.
Right.
Yes, and they are our leadership when it comes to emergency and disaster.
Right.
And our preparation starts from the communities, and our preparation also should start with the system. Okay, so I would look at it in the systemic, and I'll also look at it in the communities.
Okay.
So at the system level, we need to equip our NADMO teams very well. There were interesting videos on social media, and people were like, Ghana, you can't be sad.
If you have data.
If you have data. Because the NADMO professional himself was getting drowned.
Oh.
And didn't have the jackets, the life-saving jackets and other stuff. So we need to equip the national body that is supporting us when it comes to disaster. Equipping them means we have to get the evacuation vehicles around, and we also have to get more logistics.
Right.
Next, I'll move to the ambulance service.
Yeah.
That is also the system. So we also need to prepare them with all this. Municipal and district management teams, as well as our MMDs. Yes, they also need to be prepared. Even though it's, for us, we are fortunate because of the location of Ghana and the landscape. We don't have so much of these floods, but the tidal waves are there. The Bagre Dam will be overflowing, and they would release some of the water. The Woja too will be full very soon, and so those are the spots flood issues that we have. And because they are sporty, we can quickly attend to them and have the right logistics. So the evacuation, all the logistics that we need for evacuation have to be in place. Then the life-saving for our electricity company also needs to be in place. Then I'll move to the community.
Right.
Yes, so with the community, it means that all of us need aqua taps in our homes, so that aqua taps or PNG for water purification. Okay. So after a flood, you need to purify your water before you use it for any other thing. Then you also need to have cleansing, good hygiene, right? And you have to have improved water source. there's also the need for you to have few first aid kits at home.
Okay.
Somebody will say the first aid kits might even be flooded as well. But then, in case the flooding does not take them away, you have something to rely on. So
do you think we should get a life-saving jacket at home as well, as we have the fire hydrants?
Yeah, I think so, because if you live in a disaster-prone or a flood-prone area, these are some of the things that you need to have. So you need to have a small wardrobe where you have these few emergency stuff there. And for our systemic body, every staff has to be equipped with these things. So if you are a staff who works in these disaster management organizations, in disaster management teams, you need to have these logistics available. Yes. So should I continue to World Vision?
No. Let's hear Dr. Benson too, before you come to your organization.
Yes, thank you.
Right.
No, can I speak to your audience?
Please do. I give you all the time.
Because I want you to look straight into my eyes.
Wow.
I want to let you know that it is very important that we all become very responsible in our communities. We have gutters that people have intentionally put rubbish in it to ensure that it is blocked. You have seen it and you are not saying anything. You are one of the reasons why people are dying from floods. I want to encourage us that let's bring back this community...
Town council.
They are there. The health promotion officers are there.
Sanitation officers.
Yes, Michael and Co from the School of
Public Health.
Accra School of Hygiene. They are doing well. But let's bring this community responsibility back. What happens to communal labor? People are trying to now become more nuclear than staying together as a community.
Right.
On Saturdays, let us come out. On holidays, let us come out and clean our societies. I want you to become a key informant in your community.
Right.
We have what we call there is this mantra that is it see something, say something. It's very important that if you see someone pouring garbage when it rains out, people building in waterways, people trying to fill beaches, where waterways, they go and buy sand and fill it. You need to call the police, because ignoring it today may be your disaster tomorrow.
Yeah.
We need to be very, very vigilant when it comes to these things. People are building in waterways, and because they have power, they are doing it, and people are quiet because of money. It is very important that once you are buying any land, you ensure that you work with the Lands Commission to ensure that you are not building in waterways. A friend of mine has had to leave his house.
Yeah.
Because once they release they open the Wager Dam, it becomes a swimmer. So it's very important that we...
He built in the waterway.
I was saying that probably he has to use the place for a fishing farm. It's very important that we are very responsible in the community. So that will go a long way too.
So we should be each other's keeper, in a nutshell.
Yes.
Okay. So World Vision Ghana, World Vision International, or Ghana?
Ghana, World Vision Ghana.
World Vision.
Yes, so we have localized to World Vision Ghana.
Okay.
But yes, of course.
We have the international body and then Ghana. So when last June's disaster happened, I saw some of your media release, press release and all that. So what other things are you doing to help us?
Yes, thank you so much once again. So for World Vision, it's actually a humanitarian organization.
Okay.
But in Ghana, because we don't have so many of these humanitarian issues, the disasters, we do a lot of development work. And what my doc measured is a clear water sanitation and hygiene issue. Right. Sanitation in Ghana, it's one of the areas that we all need to put our hands on deck. And so one of the main areas for intervention for World Vision is water, sanitation, and hygiene. And during this flood, we are supporting communities with purification, water purification. That is the PNG. So that one, we give it out for free. So it's not for sale. Then I
haven't received mine.
Please,
Dr. have you?
No,
we need
you don't live in a disaster prone. You don't live in. I know where you live. It's not flood prone. And Dr. Usu too didn't build in the waterways, so he's not also. Yeah. So, but I can have some available to you.
So people who are struggling and they need this, how would they get it?
Yes, so people who are struggling and they need this, they can contact the World Vision office in Accra, or if you live in the communities where World Vision work, we do the donation, so it's out there. Okay. We donate to Ghana Health Service, we donate to these government institutions to also donate to other.
And people just walk to World Vision, any World Vision office for such a thing, for purification?
Yes, so if you are in a community that is disaster prone, yes, you can contact the manager and then you get some. It's something.
So apart from this?
Yes, so apart from this, for the hygiene staff, we also support with your hand washing equipment, your soap, and your Veronica bucket. So the health facility is key, because if there is any outbreak, recently I'm hearing a lot of diarrhea cases, so there should be a lot of hand washing. And there's also a lot of flu, so you need to be very hygienic so that you don't get any flu. Then in addition to that, we also are supporting with the health facilities, so equipping health facilities with basic equipment that they need. Recently we've done some donations and it's out there in the social media, but we are hoping to continue to do this. Now, after every flood or after every emergency, there is usually an assessment. So the interagency in the country with all other key bodies, the UNHCR, the WHO, all of us have come together and that assessment has been done. So based on that assessment, and we know the impact of the population affected and the people that are homeless, and then level of support that people will need, the response will be declared and that response would come adequately. But before that response, these are other things that are being done. For the facilities that we also visited before the disaster and noticed that they are disaster prone and they've been closed out, we have engaged the government and its authorities to see how best we can plan and provide them with the needed logistics. And
wow.
Yeah.
World Vision Ghana, you are doing well. Thank you so much for helping helping our communities. It's a Christian organization,
yes,
right?
So World Vision is a Christian organization. It's a child-focused organization as well. So we also continue with the sensitization advocacy. Like I'm here, we are all putting our heads together to let the message go. So the education, the communities, all that is already ongoing.
Yeah. Thank you. Thank you for honoring our invitation and also coming to tell us we haven't finished, my dear. I want us to even discuss something about mental health briefly. How does it affect? How does flood actually affect mental health? Briefly.
The June 3rd flooding.
Right.
I used to work for the Den Vodafone.
Was it 29th or 3rd?
No, the 3rd.
The 3rd was 3rd June.
One.
The second one.
The second one.
Yes.
I used to work for the then Vodafone Health Line call center. And during that we're educating people.
Yeah.
All that we heard was boom.
The fire.
How many? It's almost a decade now.
Yeah, almost, yeah.
When it rains, I still hear that.
Oh, that sound.
When it's there are tender, that moment flashes back. And during that period, I remember 2 of my colleagues. They died.
We lost them. Sorry.
We lost them. You see, the question is, after all these years, what have we done to support people that have experienced this negative life event? Do we just go and donate to them as a country and leave them? People have developed a lot of mental issues post this.
Yeah.
It's very important that churches, mosques, and other social organizations like
philanthropists and all that.
Come together and support them as a family. It's not just enough donating to them, but regularly checking up on them to ensure that they are good, even if we have to refer them to psychologists. It's very important. We mostly act very strong, but we can never take away the role of these people.
Yeah.
I would also want to encourage the Ministry of Health, the NCC. Growing up, I saw adverts of NCC. You know, this HIV, Kofi will call him, and all that. Every child knew that storyline. Today, where is it? It's very important that, and I want to urge our listening president to work with all the other agencies to strengthen the capacities of this organization. Like the NCC. NCC, we have missed you. Come back and start.
NCC, we have missed you. Oh.
The education. Let it be.
But the office is functioning now.
They are functioning. Occasionally.
Well, when was community? Okay, I like the word she used, occasionally. We want to bring back those vibes that we saw, the cartoon that every child can know. If it's showing on Joy, we know that millions of people watch this, and people will learn. Let's go back to the basics. Let's go back to infuse it back into our curriculum. How people can be very responsible, how they should not throw things around, and let's not break our families. Stop being so nuclear. Let's go back to family bonding
system.
How do you call it? The
extended family,
where everybody is there for everybody. With that, we'll be able to tackle the mental health related issues.
When everybody's issue was everybody's
issue.
It's like we are all minding our businesses.
Children don't play with the neighbors' children.
Pathetic. We are all at fault. Irabna, would you like to give a final word?
Yes, so thank you once again. Finally, I think as a country, we need to work on our sanitation. That is one key area. And also, we need to be able to have a community refuse dam. Every household need to have a toilet facility.
Okay.
We also need to help our health system work well and help the MMDAs and all the other systems work well. So in a nutshell, all what we have said is that we need to have a functional country where in times of emergency, we can see limited casualties.
Right. I guess you are done, or?
Yes, a last word.
One second.
We have public health laws, we have the sanitation laws, but it seems that we have diarrhea for policy making, but constipation when it comes to its implementation. So let's work together to ensure that every law that we have in relation to sanitation, we implement it. Thank you.
Thank you very much for watching Consulting Room 5 with me, your host, Dr. Sue, Dr. Benson Owusu, and Miss Irabna Kwebadazi. Thank you for coming. Thank you for honoring my invitation. Their key word is that whether flood or no flood, prepare yourself towards flood. Also, get certain things they have mentioned. I wouldn't want to go back and repeat, but we should get ourselves prepared. Our personal hygiene should also be prioritized. We shouldn't. We should mind other people's business in terms of health. When you see somebody is in need, help the person. When somebody is throwing rubbish at places where they are not supposed to do, report the person. So be other person's keeper as we help to reduce the health effects that flood comes with. You would have me again next week, same time. Enjoy Dr. Sue with Consulting Room 5. Bye.